Okay, so I think we're finally ready to begin. I apologize. So my name is Danielle Sandy. I'm a public health nurse here in Prince Albert. And Mark had asked me to talk to you guys today about standard precautions and bloodborne pathogens. So standard precautions, basically what they do is they help us protect against all infectious diseases. So it doesn't matter whether we're talking about HIV, hepatitis, scabies, lice, it helps against all of those. So what are standard precautions? Basically, they're an infection control guideline, and they're designed to protect people from diseases that are spread through blood and body fluids. One of the key points is that you always assume that all blood and body fluids are infected until you can prove otherwise, basically. So, we don't treat people any differently if we know that they have hepatitis or if we don't know that they have hepatitis. We always use the standard precautions. Standard precautions kind of combine two terms that we used to use before. You guys may have heard of universal precautions. And that basically kind of just dealt with when you were going to be dealing specifically with body fluids. When we talk about body fluids, we're talking about blood, we're talking about saliva, we're talking about nasal secretions, sweat, urine, feces, sputum, so stuff that they cough up, vomit. It includes all of those. As far as, so the universal precautions used to say that you only needed to worry about, vomit or feces if it contained visible blood. Standard precautions now says use these precautions with every body fluid, okay? So why does it matter? Well, as you guys work with children, basically you have a potential for exposure when the kids get injured or when you're providing care for them. The standard precautions are a way not only to protect yourselves from the children, but it's also a way to protect the children from yourselves. So we think of this as two different ways, because we may have something that we don't want to give to the kids, whether it be a bad cold, whether it be something, within our blood. So it works both ways. And the other thing is that you don't want to bring something that you've been exposed to back home to your families either. So it kind of protects everybody. So I'm just going to talk a little bit about the chain of infection. Basically, every one of these little circles, little points of the chain has to, I have no idea what that is. Oh, sorry. Every one of them has to be met in order to send a disease from one person to the other, okay? If one of these links is broken, then it won't be passed on, okay? So first we have the infectious agent, and that is basically just a germ that's capable of causing disease. So that could be a virus, it could be a bacteria, it could be a fungus or a parasite, any of those. The reservoir host, that is basically the area where the germ can survive, okay? So it doesn't necessarily multiply there, but it just lives there. So we're talking about, it could be soil if we're, dealing with tetanus. Tetanus lives in the soil, so the soil would be the reservoir. It could be medical equipment. So, I gave a needle, and if I gave a needle to somebody who was infected with hepatitis B, there would be blood on that needle that I could spread. So that would be its reservoir, okay? The portal of exit, that's basically just how the germ leaves that reservoir, okay? So It could be in the blood, it could be in body fluids, it could be in nasal secretion, so if somebody coughs or sneezes, that would be the portal of exit. The mode of transmission is basically how it gets from that reservoir agent into the susceptible host. Okay, so is it airborne? Is it direct contact? So is it blood to blood contact? Or is it through indirect contact, being that I could sneeze and the droplets could fall on the table, and then you guys touch the table, and then touch your mouth maybe, and it gets in that way. So that would be indirect contact from an object. Okay. The portal of entry is how it enters the system. So how does it get in? Is it again through a mucous membrane? Is it through the GI tract? So do you eat it? Is it that you breathe it in? Is it that it goes into your blood? Okay. And the susceptible host is basically the person who is not already immune to that disease. Okay, so you can carry that specific thing. So there's 6 steps to what we call the standard precautions. The first one is hand washing, then the appropriate use of barrier techniques. The third is the cleaning and sanitizing part. The fourth is how we dispose of the material that may be infected. The fifth is not sharing personal items, and the last one is reporting of the exposures. So I'm going to go through each of those. So hand washing is your best defense against any kind of infection. Okay, and you guys have probably heard this lots last year with the whole H1N1 and hand washing was really promoted. It really is, hand washing saves more lives than anything. So there's many times during the day when we should be washing our hands, and I'll just touch on some of them. So when you arrive at work and before you go home, okay, because again, any germs that may have been in your home or that you picked up when you went through the Tim Hortons drive-through, we want to get those off before we're exposing the kids to them. As well, anything that the kids may have, we want to get off of our hands before we go home. Okay, providing personal care to someone. So Mark was saying that some of you work with people who need personal assistance, so help with bathing, maybe brushing teeth, diapering, feeding, that type of thing. So before and after you provide care to somebody like that, you should be washing your hands. After using the washroom, before and after giving first aid if you can. After outdoor activities, so if you're playing with the kids, if you're out for a soccer game or playing football or something like that, make sure that you're washing your hands. After handling any of the animals are a really good way of transmitting diseases back and forth, so make sure you're washing your hands. After cleaning up blood or body fluids, okay, after taking off disposable gloves, and we'll talk about that a little bit later. Before and after handling food or eating, okay, again, raw food is a really easy way of transmitting certain infections. And as well, when we eat, especially if we're eating, with our hands, if we're touching food, anything that's on our hands is going to enter our system. So we want to make sure that we're washing hands before we eat. After blowing your nose, sneezing, or coughing. After giving any medications. Do you guys give medications? Yeah, to the kids. So, even if it's just a pill, some of that drug can definitely get onto the surface of your skin. So you're going to want to make sure that you wash that off. And one that people often don't think about, but is contact lenses. So those of you that wear contact lens, your eye is a mucous membrane, or what we call a mucous membrane. It's a really good way for germs and to get into your system. So before and after you use contact lenses, putting them in, you're going to want to make sure that you wash your hands. So there was a hand washing study done just this past August by the American Society for Microbiology. It was done down in the States. They had 6 locations in 4 cities. So they used Atlanta, Chicago, New York, and San Francisco. And basically it was a 2-part study. First, they did random phone calls to houses, and they asked the adults how many people wash their hands after using a public washroom. 96% of adults said they always wash their hands, when they were in a public washroom. So then what they did is they did discrete observations. So they actually housed themselves in these washrooms and recorded how many people washed their hands or not. And out of the 6,028 people that they watched, only 85% of people washed their hands. Women were way better at it than men. So women came in at 93% and men at 77%. So even though we say that we wash our hands, obviously sometimes we don't. And yeah, those public washrooms, you're gonna wanna be washing your hands. So I thought I would just show you a little movie here.
CDC TV presents Health Matters.
At the Centers for Disease Control and Prevention, we are very interested in preventing transmission of disease in our community.
People aren't washing their hands as often as they say they are or as often as they should. Some scientists estimate that up to 80% of all infections are transmitted by hands.
And the germs can live on our hands for quite some time unless we clean them. If we don't clean them and we go and touch something in the meantime, we can spread those germs to other places or other people, and disease can be spread this way.
Animals can carry germs that can make people sick, and these germs can be not only on the animal, but can be in areas where the animals live as well.
When people do regular hand washing, especially with children, that you supervise that hand washing, so you make sure the children are doing it properly and for the length of time that's necessary.
They're coughing and sneezing onto their hands and touching doorknobs. They're using shared objects like pencils or toys. And disease is passed easily from one child to the next.
Try and avoid sneezing into your hand because you just contaminate them and then spread those germs everywhere. Focus on sneezing into your elbow, like this, and then you don't contaminate your hands. Turn on the water, wet your hands, apply a good amount of soap and lather up, and then focus on washing your hands for about 20 seconds, about the time it takes to sing Happy Birthday twice. Focus on washing the front of your hands, the back, in between the fingers, around the nails, and so on. And then rinse everything off. Use something to wipe your hands after that, preferably something disposable like a paper towel, and then use that to turn off the tap as well. If you get a chance, use that to also open the door to the bathroom as you're leaving. The best way to wash your hands is using running water and soap, but sometimes we don't have that available. So think about carrying with you a hand sanitizer. That should have at least 60% alcohol content.
It's important to realize that those agents don't remove soil and other material that might be on your hands. And in that case, you really need to use soap and water.
If you've been touching objects all around you all day long, just assume that your hands are contaminated and make sure before you prepare food, you wash your hands. Before you eat, that you wash your hands.
You can't emphasize hand hygiene enough. Clean hands save lives.
Keeping your hands clean is a very important activity both at home, at school, at work, and in the healthcare setting.
Hand hygiene or hand washing is the single most important thing that you can do to help prevent the spread of infection and to stay healthy and well.
All right, so I'm just going to go through a couple of the things. You guys probably already know this, but I'm going to beat it into your brains here anyhow. Covering your cough. So really important that when we do cough, that we don't cough into our hands. Okay, our hands we use for everything. If we cough into our hands, we're going to transfer that, all around. So what we do suggest is the coughing into your sleeve. So cough into your elbow instead of into your hands. The alternative is, coughing into a Kleenex and then disposing that immediately into the garbage. And then anytime that you're doing coughing or sneezing, you're going to want to wash your hands after, okay? So for the hand washing, most of us really think that we wash our hands good, but very few of us actually wash our hands really good. So I'm just going to go through the basics again. Usually what we say is it should take about 20 seconds or so of actual scrubbing to wash your hands effectively. That's like singing happy birthday twice, they say, is how long it should take you. So what you're going to want to do is just moisten your hands with water first, and then hopefully you guys all have liquid soap in the homes. We want to try to stay away from bar soap when we're in a washroom that many people are using, because the germs just get onto that bar soap. So we want to use liquid soap. We're going to put some on our hands and we're going to lather. And what we want to make sure is that we're actually washing our hands, not just washing our palms, okay? So many people do this and then they rinse off, okay? But there's more to our hands than our palms. So you want to make sure that you get in between your fingers. You want to make sure that you get your thumbs. So just take your hands and do your thumbs. The backs of the hands are usually almost always forgotten, so you want to make sure that you do the backs of the hands, even up onto the wrist area, okay? So you're going to scrub all of those. You're going to just kind of give your tops of your nails a bit of a scrub, okay? And then you're done, okay? So you've washed all the portions. You're then going to rinse it under water, and when you rinse it, you want to not rinse it like this, because not only will your arm sleeves get wet, but you're taking the dirtiest parts of your hand and you're washing those germs back onto your arms. So you want to hold your hands downwards when you're rinsing them off, okay? And then, like they said on the video clip, is hopefully use paper towel to dry off your hands. Again, we want to avoid using a communal, hand towel in the bathrooms, because those germs are just getting on the hand towel and we're just spreading them back and forth. So use a disposable towel to dry your hands. Use that paper towel to then turn off your tap, okay? Because remember, your hands were dirty when you turned them on. So if you use your clean hands to turn off the taps, you just contaminated them again, okay? So use the paper towel to turn off the taps and hopefully to open the door, okay? Because again, that doorknob is not the cleanest in the world. So that's how we're going to wash our hands. If you do not have running water available, you can use the alcohol, okay? It needs to be at least 60% alcohol, okay? And how you do it is basically, you're going to put about a dime size blob on your hand, and then you're going to use it exactly the same way as you would with the soap and water, okay? So kind of start on your palms, and then you're going to do your thumbs, the back of your hands, in between your fingers. The key with this stuff is that you have to rub it until it feels dry, okay? If you stop before it's dry, then you haven't effectively washed your hands, okay? The other thing is that if your hands are visibly soiled, so if they have visible dirt on them, if they have visible blood on them, you need to use soap and water, okay? This only works for the invisible germs, okay? So barrier techniques was the step number 2 of standard precautions. So basically the barrier creates, between your blood or body fluids and somebody else's blood or body fluids, okay? It protects our mucous membranes and it protects our personal clothing. Unbroken skin. Our skin is a wonderful, effective barrier against diseases. But if our skin has any little cuts, abrasions, sores, acne, so you have pimples, germs can get in there really, really easily. So, especially in the winter, most of us have nice cracked skin. It dries out pretty easily. So you want to really take care of your skin. You want to keep it moisturized. You want to make sure that any cuts or sores are bandaged, okay, so that they're protected at work. Gloves. Do you guys all have gloves at your works? Yeah, okay. Do you guys know how to use gloves? Have you been taught? Yeah, okay. So single-use gloves are really good. One of the questions that always comes into play is if there's an emergency and I don't have gloves available, is do I provide the medical care, or do I run and get gloves? And that has to be your call. I can't tell you what's right or wrong. The risk of getting, a bloodborne disease from providing treatment is pretty low. Okay, but you guys know the population that you're working with, and you guys need to make that call. So the big thing with the gloves is that you don't want to touch the glove when you're removing it. Okay, putting them on is easy enough. When you take them off, okay, what you want to do is with the one hand, you're going to just grab at the top and you're going to turn it inside out. Okay, so you're just peeling it, turning it inside out. And then what you're going to do is with your hand now that's not gloved, you're going to insert your finger inside so you're not touching the outside, and you're going to peel it back, okay, so that this forms like a little disposable garbage. They're one inside the other. Now the only thing that I'm touching is the inside of the glove, okay, and then you're going to put them in the garbage. Okay. As soon as you are done removing your gloves, you need to wash your hands again. Okay. So other protective equipment that you may see, CPR masks. Do you guys have breathing masks at all in the houses? So that would, hopefully we never have to use them, but if you ever do have to do CPR or breathing on somebody, use a mask. There's face shields, there's gowns. Usually that's more in a healthcare setting. If we're thinking that splashes may be imminent. So I don't think that you guys need to worry about those ones. So you want to make sure that you use this protective equipment anytime that you're given first aid, anytime that you're cleaning a wound, or anytime that you're going to have contact with blood or body fluids. Okay. If your clothes gets blood or body fluids on there, so if a kid throws up on you or something like that, make sure that you remove it as soon as possible. Obviously you guys would probably want to do that, and put it in a plastic bag until it can be laundered. Okay. So the cleaning and sanitizing, again, any blood or body fluids, you're going to want to wear gloves to clean up, and you're going to want to use disposable towels to clean it up. So paper towel or a disposable rag, something that can be thrown away. You're going to wash the area with soap and water first, and then rinse it, and then put a bleach solution on it. It's the bleach solution that's going to disinfect to get the germs off. Okay. Once you apply that bleach solution, then to clean that up, again, you're going to use disposable towels to absorb it. The bleach solution that you need to use is a 10% bleach solution, so 1 part bleach, 9 parts water. If you have, some places have where they just keep some in a little spray bottle to use, that needs to be made daily. Okay. The bleach breaks down with temperature and with sunlight, so you want to make sure that that bleach solution is made fresh every day. And you want to leave it on for about 10 minutes, okay, to let it disinfect. The other thing is with the bleach solution, never mix it with something else. So you just want to mix bleach and water. Don't ever, use bleach in combination with another cleaner, because the fumes will get toxic and you might blow something up. So that's never a good thing. So the disinfection will kill most organisms that we're concerned about. So things like streptococcus, staph, E. coli, salmonella. So if we're dealing with food, it will kill HIV, and it will kill the most of the hepatitises. Okay. So proper disposal. Any articles that have the blood or body fluids on it should be put in a plastic bag. So our disposable towels, rags, things like that. Then you want to put that into a garbage can that's got a plastic bag in it. Okay, so it's kind of a double bag system. If it's laundry, you want to handle it as little as possible. So again, if you need to transport it, from one area to the laundry room, try to put it into, a plastic bag, something that's not going to be used over again. Again, if we put it into a laundry hamper and it sits there, those germs are in the laundry hamper. So put it in a bag, use gloves and rinse it in water first, and then put it in the washing machine with hot water and in the dryer for the hottest setting that clothing can use, okay? And that will disinfect any of the articles. You definitely, unless it's really soaked in blood, you can wash things with it, okay? It doesn't need to be washed separately, okay? Sharps. So probably the most common way of transmitting a bloodborne pathogen is through, a needle stick or, some other object that punctures our skin that's contaminated with an infected agent. So proper handling, so never recapping needles. If you guys, do come across needles, is don't bend them, don't try to break the needle portion off. Wear leather gloves or use tongs to pick up the needle. You're going to put it in a puncture-proof container with a lid, and then wash your hands afterwards. So the next point was avoiding sharing personal items. So things like razors and toothbrushes, nail clippers, lip balm, eating utensils, face cloths, combs, towels in the bathroom, they all can contain blood or body fluids. So we want to make sure that the personal items are separated in the home, okay? And lastly, reporting exposures. So if you do have an injury, you want to try to wash that area with soap and water if possible. If it's a membrane injury, so if it's a splash into the eyes, the mouth, your nose, flush it with water, okay? Any significant exposures need to be reported to your employer, and then you need to go to the nearest hospital to be assessed for possible risk, okay? If you know the source of your contact, so if it's a needle stick injury, let's say you were, giving a medication that you had to, give through a shot, and you poked yourself with that needle after the shot, whoever you were giving the needle to, if they can come with you to the hospital, that's a real easy way of finding out quickly if you may have been infected with an agent, because we'll do blood work on the source and we'll do blood work on you, and as long as you both come back negative, then we know there's no possibility to spread anything. So if you know the source, bring them as well. So the risk assessment, like I said, the most common way of getting a bloodborne pathogen is probably going to be an accidental puncture from a sharp, okay? It could be, through broken skin. That would be the second way. So if we have a cut or sore, and we're providing first aid to somebody, or contact from the mucous membranes, okay? So germs live, spread, and move basically from person to object to person. So if I had an open sore on my hand and I was using the telephone, and then somebody else picked up the telephone, and then they touched part of their body with it, that's how it would spread, okay, how it would transfer. So germs can live on basically anything, whether they're objects in a room or outside, whether it's in a classroom setting, whether it's in cupboards and closets. Doorknobs are really great for storing germs. It can be in vehicles. So basically anywhere you can think of, germs are hiding. So person to person is when you actually come in direct contact with the blood, okay, or body fluid from another person. So there's no object, it's actually just the direct contact. So we can possibly get exposed this way by not using our personal protective equipment, okay, so not using gloves, by not using proper hygiene. If we have a wound, okay, and somebody else's blood gets into that, through airborne secretion. So again, if somebody's got whooping cough, let's say, and they're, hacking out a lung, and we're breathing that in, okay. Unprotected sex, or from a mother a pregnant mother to the baby, okay? And those are basically the only ways that you can get it person to person. The bloodborne pathogens that I'm going to spend most of my time on are the hepatitis B, hepatitis C, and HIV. And then we're going to talk a little bit about hepatitis A and something called MRSA, which you guys may come into contact with. So with hepatitis, hepatitis is caused by a virus. Okay, there's different forms of hepatitis, and they use letters. So they start at A, and I think they're all the way up to like G right now. So there's different types of it. It usually can cause long-term illness. It can cause disability, and it can kill you. Okay, so it's not something that we really want to fool around with. Like I said, it affects our liver, and our liver is one of those organs that we can't live without. It does a lot of different functions for our body. It helps digest our food. It stores vitamins and minerals. It helps filter out different chemicals and substances that enter our body. And it also helps with the manufacturing process of different proteins and blood. So without our liver, we do not live. Okay. Hepatitis A is usually a mild illness. It can last about 1 to 2 weeks, but it can last up to several months. Okay. About 15% of people that get hepatitis A, they get what we call the renewed illness. So meaning the symptoms come back for up to a year. Okay. Once you have hepatitis A, you build lifelong immunity to it. Okay, so if you actually get the disease, you're going to be protected for your lifetime. The older that you are when you get it, usually the more severe it is. And it's transferred a really nice way to think, the fecal-oral route, meaning it's transferred from poop to mouth. Okay, so usually it's from exposure to contaminated water or food. It can be occasionally transferred through unprotected sex as well. And people are contagious about 2 weeks before they become symptomatic, so they transfer it before they actually know that they're sick, to about a week after they have the symptoms. Okay, so with infectious diseases, sometimes it's really hard to prevent because we don't even know that we have them. Okay, we transfer them before we're symptomatic. So hepatitis A, this is often the one that you hear, people are traveling to Mexico or the Dominican, and it's always, well, did you get your Hep A shots? Okay. Areas that have poor sanitation are usually where we're gonna pick this up. Okay. It's gonna cause symptoms like jaundice, which is the yellowing of our skin. We're gonna lose our appetite. Usually we have stomach pain. We can have nausea and vomiting as well. Our urine is going to become quite dark. We're going to feel very tired, and we may run a fever. Okay. So how do we prevent it? We can immunize against it. Okay. So it's a 2-dose immunization. You get 1 dose, and then 6 to 12 months later, you get a 2nd dose. Good hand washing is really important. Good hygiene. Okay. Travelers, like I said, people that are traveling to different parts of the world where sanitation is poor need to be immunized prior to going. Okay, and cooking foods appropriately. Okay, so not eating raw shellfish from contaminated areas, not drinking the water in certain areas when you're traveling, just using bottled water. Okay. Diapering is considered a high-risk activity, so anybody who's working with people that need to be diapered, that's a real common way of transferring hepatitis A because, again, it's that fecal-oral route, right? So your hands get contaminated from a person when you're diapering them, and if you don't wash your hands good afterwards, then you transfer that to whatever activity you're doing next. Okay. So hepatitis B, again, it affects the liver. And it's about 100 more times infectious than HIV, meaning that it takes very little hepatitis B virus to cause the disease. Okay, it's often a chronic disease, so it lasts. Okay, about 5% of our population will get hepatitis B in their lifetime, And again, with this one, a lot of people never have any signs of infection, okay? So they don't know that they have it, so they continue to spread it. And with hepatitis B, you can also become a carrier. So hepatitis A, once you have it, you're sick for a while, then the virus leaves your body and you have lifelong immunity. With hepatitis B, that virus does not necessarily leave your body. In about 10% of adults and 90% of infants, when you're infected, you become a carrier, meaning that that virus is always in your blood and body fluids, and you can always be spreading it to other people, okay? It's also a really resilient organism. It can live up to 7 days in dried blood, okay? So it's one that we need to be really careful of. It's going to be transmitted through blood or body fluids, so entering a non-immune person. So if you have immunity, if you've been immunized for hepatitis B, okay, and you have known immunity, it doesn't matter if you come into contact with the infected blood, because your body can fight that off, okay? That's the whole purpose behind the vaccinations. Sharing personal items like razors and toothbrushes, having unprotected sex, sharing needles, so tattooing, body piercing, drugs, blood transfusions prior to screening, or if you travel to areas of the world that don't screen their blood, sharp exposures, and infected mother to the baby. Okay, so any woman who is pregnant is usually tested for hepatitis B during pregnancy. If they are found to have hepatitis B or be a carrier hepatitis B, then we immunize the baby as soon as it's born, okay, to protect it from becoming a carrier. So again, the symptoms, they can be very mild, just some flu-like symptoms. People think, oh, I've just got the flu, okay? They can be tired, they can get some stomach pain, loss of appetite. There can be some nausea and vomiting, okay? About 10% of kids and anywhere from 30 to 50% of adults will get that jaundice, that yellowing of the skin. Again, you can have some dark colored urine, and 50% will have no symptoms whatsoever, okay? Even though they don't have symptoms though, they are spreading it, okay? So how do you protect yourself? Immunization is probably the easiest way, not engaging in the high-risk activities, okay? Once you have hepatitis B, there is no cure for it, okay? So that damage is done to that liver and we can't reverse that at all. With the hepatitis B vaccine, it's a series of 3 shots. You get 1 dose, a month later you get a second dose, and then about 5 to 6 months later you get your final dose, okay? The hepatitis C virus. Hepatitis C is becoming more and more common. We definitely have a lot of it in Saskatchewan. It's a very chronic disease. It goes on for many, many years. There's about 250,000 people in Canada, so about 1% of our population that is hep C positive. And about 1,000 people die each year from hepatitis C. Most people don't have symptoms, or the symptoms take decades, okay, like 10, 20 years to develop. However, they can transfer it, they can still spread it during that time period. So it's the actual damage to the liver that causes those symptoms. The virus can live on surfaces at room temperature for anywhere from 16 hours to up to 4 days. So it's not quite as resilient as hepatitis B, but it can still live for quite a long time. And it may not be killed by bleach. Okay, they have done study after study, and they haven't really been able to prove one way or another whether bleach will kill hepatitis C. So we definitely recommend that you use bleach, and hopefully it will kill it, but there may be the possibility that it may not. Okay. Hepatitis C is really becoming a drain on the healthcare system because we have such large numbers. It is something, you know, we see more and more liver transplants being done because of hepatitis C. But you have to remember that hepatitis C doesn't live in the liver, it lives in the blood and body fluids. So even if a person gets a liver transplant, that new liver is going to become infected for anywhere from 1 to 3 weeks after the transplant, okay? However, because it can take years to do enough damage to the liver to become symptomatic, you know, there definitely is a benefit to the person receiving the transplant. Okay. The other thing about hepatitis C is that you can get it more than once. There's more than one what we call genotype of hepatitis C. So a person can have one genotype and get another genotype. So you can definitely get hep C more than once. It doesn't give you lifelong immunity. The most common way of getting hepatitis C is through sharing needles or drug equipment, okay? Sharing personal items, so the things like the razors and toothbrushes, contaminated equipment during medical procedures, body piercing, tattooing. We see a lot of people that is their only source of infection. Exposure to sharps, so those needle stick injuries. Again, babies can get it if the mom is hep C positive. Blood transfusions. We saw a lot of people before we tested our blood, so before 1992, a lot of the hemophiliacs that got blood products on a regular basis became infected with hepatitis C that way. And unprotected sex that includes the exchange of blood. So this one is basically just found in blood. It's not really found in semen or vaginal fluids. It's basically just the blood. So about 80% of people have no symptoms whatsoever of hepatitis C. Again, the symptoms, once they start to develop, are very similar to the other hepatitis, where you're tired, lethargic, just no appetite. You may have sore muscles and joints, abdominal pain, and again, you can get that yellowing of the skin, okay? Usually by the time you become symptomatic, basically your liver is starting to fail, okay? So there is no vaccine against hepatitis C. So basically you need to try to avoid the risks. About 15% of the people who become infected with hepatitis C, within about 6 months of becoming infected, they'll clear the virus on their own, okay? The virus will just disappear from their body. The other 85% become chronic carriers, meaning that they have it. There is a treatment that has been used with some success using interferon and ribavirin, and it's anywhere from 24 weeks, so about 6 months, up to 72 weeks, so up to about a year and a half of treatment. It doesn't work on everyone. There's certain genotypes that it works better on than others, and you have to meet a certain criteria in order to be put on the treatment. And it's a long treatment. The side effects can be quite severe, so it's definitely not for everyone. So HIV, so the human immunodeficiency virus. HIV is the virus that causes AIDS, or the acquired immune deficiency syndrome, and basically it attacks the immune system. So basically in our body, in our immune system, we have these cells that are called CD4 cells, or helper cells. And basically what happens is that the HIV virus infects those cells, and instead of those cells replicating to normally to help kill off different bacteria and germs that get into our bloodstream, the HIV virus uses those cells to replicate on its own. And so the more CD4 cells that the virus infects, the less CD4 cells we have to fight off diseases, okay? And the more HIV virus in our blood, okay? So when the immune system is depleted of those CD4 cells, then we become more susceptible to certain diseases, what we call opportunistic diseases, okay? And it's once that CD4 count gets low and we start seeing some of those diseases that we're said to have AIDS, okay? So while the virus is doing its replicating in our body, we're considered HIV positive. Once we start getting certain diseases, then we're considered to have clinical AIDS. Some people develop kind of a mono-like illness 1 to 2 weeks after they have been infected with HIV, okay? But it's not really until a person's immune system is overwhelmed by the HIV that the symptoms come out, okay? And that would be rapid weight loss, fatigue, you have frequent fevers, night sweats, you get swollen lymph glands, okay? You can get rashes in your mouth, so things called thrush. So in babies, we often see thrush. It's basically a yeast infection in the mouth. People with HIV, it's very common for them to get the thrush. There can be genital and anal sores, chronic diarrhea, and a cough that just doesn't seem to go away. Those would all be signs that the HIV is progressing. So how is it transmitted? Again, through the body fluids, so blood, semen, vaginal fluids, and even breast milk. Okay, so women who are HIV positive shouldn't be breastfeeding. So unprotected sex, sharing any kind of drug-related equipment, the unsterilized tattooing equipment or body piercing equipment, sharing personal items, and through pregnancy and breastfeeding. Okay. So basically, if you're partaking in any of those categories, it's possible for you guys to get HIV. Okay, it's not a gay disease. It's not a disease just of IV drug users. Basically, anybody who partakes in those diseases can get it. We have seen a real increase in the number of cases in Saskatchewan. In 2008, we had 173 new cases. 4 years before that, we had 54, so that's a huge jump. Definitely injection drug use was reported in the majority of cases, 133 of them. But what's really scary is that our young population, the 15 to 19-year-olds, we're seeing more and more cases in that age group, and 10 out of 13 of these cases were Aboriginal females. Okay, so our Aboriginal population is really being hit, hard by HIV. In 2009, we had 155 cases of HIV, so down a little bit, and 10 cases of AIDS. And in 2010, so just this year from January to September, we had 122 cases here in Saskatchewan, and so far 9 cases of AIDS. So it's not going away. Okay, we are not learning very quickly at all. Here in Prince Albert, in 2009, we had 26 cases of HIV and 1 case of AIDS here in PA. Okay, so HIV is actually a very fragile virus. It does not live long outside the body, so it's not like a hepatitis virus that can last for days. It actually dies quite quickly. It's basically employees who are providing first aid care or care involving blood. Okay, that's your exposure risk. The chances of actually contracting HIV in the workplace is very minimal. Okay, but because it's a deadly disease, we need to make sure that we take precautions. Okay. When we look at rates of HIV or rates of getting the different hepatitises, just to kind of put it in perspective for you guys, if we took a person that we knew was HIV positive and we stuck ourselves with a needle that had been in them, okay, the chance of us contracting HIV is 0.5%. Okay, so that means like 5 people out of 1,000 would contract HIV. So there's a 99.5% chance we won't get HIV from a needle stick injury when we actually know the person has HIV. Okay, if we took a person with hepatitis B, and again we had a needle stick injury with that person, the chance of getting infected with hepatitis B, if we were not immunized against it, is 25%. Okay, so 1 in 4. So a lot higher risk of getting hepatitis B. Hepatitis C is about 5%. So if we took a hepatitis C patient, stuck ourselves with it, 1 out of 20 would become infected with hep C. Okay, so even though the fear out there is always for the HIV, you're more likely to get hepatitis B or hepatitis C than the HIV. Okay. MRSA is the last one that I'm going to talk about. This is methicillin-resistant Staph aureus. Okay. Basically, the reason that I'm going to talk about this is we have it in huge numbers here in Saskatchewan, Prince Albert, really huge numbers. Most of it is what we call community acquired. Okay, so we're just getting it from the community. So I just want you guys to be aware of what it looks like so that you guys can get treatment or get the kids looked at. Staph itself is nothing new. Staph is a bacteria that lives on the surface of our skin. It can live in our nose as well. We can be carriers of staph. And most of the time, it causes no problems whatsoever. Okay, so what happens though is that if we get an injury, so if we get a cut, if we get a pimple, if we go for surgery, then the staph can get into our body. And it's once it gets into our body that it becomes the issue. MRSA are basically staph that are resistant to certain antibiotics like penicillin. So MRSA becomes an issue because we have fewer and fewer drugs that we're able to treat it with. We don't have as much choice with the antibiotics. So most oftenly it's transferred from person to person through contact with the hands or with an infected item. So things like hand towels. If somebody who had MRSA wiped their hands on a towel and they had a sore on their hand, that germ would be on the towel, and then when we use that towel to wipe our hands, then we would transfer the MRSA onto our skin. Things like razors, even bathtubs, sharing, having a bath in the same tub as somebody else without cleaning it in between. Many people are carriers of MRSA, meaning that once they have it, it just doesn't leave their body, even if we treat them with antibiotics. It'll always just, live, they'll be what we call colonized. It lives in their nose or in their anal area to be spread to others. With MRSA, the most common way that it presents is usually through a sore that just doesn't heal. It'll usually be pussy. Sometimes it's a boil. Sometimes it's just a scrape on the skin that shouldn't have really caused any problem whatsoever, but it just gets bigger and bigger, and it just really lasts. Occasionally, it can be fatal. We have definitely had cases where people have got it into their bloodstream and it's caused a mass infection inside the body, and it has killed them. People going for surgery is the other factor. So if somebody knows that they're MRSA positive, it's really important that if they're booked for a surgery that they tell the physician, look, I had MRSA, so that you can be treated with antibiotics prior to having the surgery to hopefully reduce the number of bacteria on your skin, so when they do the surgery, that doesn't get inside. Okay. So how do we prevent it? Hand washing is the biggest thing. Any sores you need to keep covered and clean. Okay. If you have sores that are draining, there's lots of pus and it's draining, you probably shouldn't be at work. Okay, because you're going to transmit that. If it's one of the kids who has a sore that's draining, you want to make sure that if you have to, change bandages and stuff like that, that you're wearing gloves to do it. Okay, not sharing personal items, so that thing like the face cloths and the towels, soaps. Any used Kleenex needs to go into the garbage, and you need to wash your hands. So the MRSA, like I said, the staph can live in our nose, so that when we sneeze or when we blow our nose, the MRSA can get onto that Kleenex. So really important to use proper hygiene with that. Good cleaning practices with a bleach solution, especially in the bathrooms and the bedrooms. So washing out the tubs between using, that type of thing. And normal laundering will kill MRSA. Okay, so normal washing and drying. And that is it. So any questions at all? No? Okay. So as most of you know, we are, Eagle's Nest is offering you guys the opportunity to be immunized against hepatitis A, B, okay, as well as the tetanus, diphtheria, the whooping cough. And because it's flu season, you can get your flu shot as well, which protects against respiratory disease, influenza. So if any of you guys are wanting that, if we haven't poked you already, just stick around and we can do that for you. And that's it.
Thank you.
You're welcome.